How can we protect human life in a society that so very frequently sees death as its ally? We'll talk about that tonight, so please stay with us. Thank you and welcome. I'm Father Mitch Pacwa, and welcome to EWTN Live, our chance to bring you guests from all over the world. And our guest tonight comes to us from the wonderful city of brotherly love, Philadelphia. And it's that same brotherly love that she has exemplified in her career as a nurse and as the Director of Bioethics and Public Policy at the National Catholic Bioethics Center. And she's here to tell us more about that organization and its efforts to protect human life from conception to natural death. So please welcome Dr. Marie Hilliard. Hilliard?
Thank you so much, Father. Thank you. It's wonderful to be here.
Good to have you here.
And thank you for that very nice introduction. And I bring greetings from the city of brotherly love. We also say sisterly love.
Yeah, I should say so.
Yeah, it's a great
You
city.
bring greetings, but do you bring any cheesesteak
Philly
sandwiches?
cheesesteak. No, I didn't bring any with me, but we do love it up there.
I know it.
It's very delicious. So you come visit us, and
All right.
I will get you a
All
Philly
right,
cheesesteak.
that sounds good to me. Also, in addition to your background as a nurse, you have a doctorate in nursing.
Professional Higher Education Administration, which is Nursing Education Administration.
So your degree was how
A
to
nurse
teach
educator.
nurses. And of course, you were a nurse.
Yeah, I'm a nurse.
Practicing,
Yes,
still are. And you also gave 20 years in a career in the military.
That's right.
As a full bird colonel.
That's right, Father.
Is that right? Appreciate your service
Thank you
to
so
the
much.
nation.
Honored to have served.
Honored
to have served.
Great. And I'm sure in part of that, there was some military has had culturally some difficulties over the past years, and it's really back as much more honored than it was, say, in the 60s and 70s. And there's a real change in the attitude that we have toward the military today.
Yeah, the honor was always there in the military.
In the military,
yes,
but honored by society.
Yeah, society, I think, has appreciated more the service that is given
That's right.
by our military. And I attribute a lot of that to the fact that people are now enlisting, especially after 9/11, and people have more family members who have volunteered to serve. And that's the thing that I think is so great about the folks serving now, that they have volunteered to serve, to put themselves in harm's way to defend our country. Perhaps at another time where people were less apt to have joined but were drafted, perhaps there is, by family members, even a little resentment. But clearly now, with the sacrifices that we're seeing our military people giving, I think people have a great appreciation.
I think that's right.
And I also have to say that in the military, and I serve on a committee for the Archdiocese for Military Services, we see a great faith among the people who serve as well as their families. And I think it's because they know the realities of living and having been in harm's way,
and the risks.
And the risks associated with
there's
it.
a sense that they also want to keep a certain rightness before God, because many of them are in such harm's way.
Absolutely.
They don't know when there's going to be time for them to meet Him.
Absolutely. And actually a great understanding of the dignity of the human person.
Yes.
Great, and many of our in-services and our mandatory in-services have to do with that. So yes, I was honored to serve and happy to serve, and would have stayed, but they do have a little cap on age, so no longer in the military. But as a retiree, I'm still a colonel, and still, they could call me back at any time. I'm not sure it will happen, but they can.
Now, besides that, you also got a degree in canon law.
I am a canon lawyer, that's correct.
And along with that, you are now working in the Center for Bioethics.
That's right,
correct?
the National Catholic Bioethics Center.
Okay.
We are based in Philadelphia now. We are a research and education and consultation service in the whole area of bioethics, because the medical questions that are being raised now raise many questions about what are the moral imperatives associated with that high tech that has advanced so quickly.
Yes.
And it's advanced so quickly that the ethical dilemmas haven't been addressed as the escalation in the high tech care, the wonderful high tech.
It's oftentimes part of the issue that sometimes certain scientists say, well, we can do something, therefore we ought to.
Right.
And
right.
that's not the kind of attitude you take to these medical advancements.
No, and if we look historically, the Catholic Church has been consistent from the beginning of time in terms of the role of the healthcare provider back to Hippocrates. Hippocrates was very...
Who was not Catholic, though.
No. Actually, today we would say pagan. He was a Greek. And his oath, which is no longer being taken because we're violating it, was very clear. I will give no deadly potions. I also will not induce an abortion. A complete understanding of the nature of the role of the physician, the role of the caregiver to enhance life, to protect life, not to kill.
As a matter of fact, I had two roommates in graduate school who were medical students. One a Catholic and the other evangelical Protestant. And both of them, along with a few of their other believing classmates, went and separately took the Hippocratic Oath.
Is that right?
You know, even though it was not administered
by their
by the
school.
medical school, they had a professor who administered the oath to them, who was also a believer. And
there's a real resurgence of that, and actually there is a pro-life medical student group now, because if you are going into the healing professions, and that's what we do, we have a yearning to heal, to help, not to kill.
Yes.
And it has been consistent in our Catholic tradition to respect human life and human dignity. But over time, as you said, when scientists have wonderful advances in technology, but there are some people that will say, well, if we can do this, even though it's going to hurt a few, or even though it's going to kill an unborn child or impact a person with a disability by some discriminatory practice, it's going to be for the greater good. And that's never been the role of healthcare. Each patient is our patient and needs to be protected. So our National Catholic Bioethics Center adheres to what are called the ethical and religious directives for Catholic healthcare services. I have a copy right here, promulgated by the bishops of this country, updated regularly, updated most recently in 2009. And it's basically a blueprint of how to address the challenges of today. It's very much up to date and available online, I might add, but very, very helpful.
So that not only a doctor, but anybody who almost inevitably will be a patient could download this.
That's right, Father.
To help them in their participation in the ethical questions at stake.
Right, and we study those ethical questions. We have 30 titles. We produce periodicals, journals, as well as books. And I have to say, almost annually, we get the top prize, if you will, rating in our field of bioethics because of the work we do. But I think for our viewers, the other things that we're involved in a certification program in bioethics where we help the consumer, the physician, the administrator, the chaplain. It's online, and it can lead at the end of our year-long certification to entree into a master's online in theology with a concentration in bioethics at Holy Apostles College and Seminary. So we're trying to help people who are in positions who are able to maintain their work wherever they are located. We had students from Asia physicians taking our certification program, so that they can go back into their own communities and answer these tough questions of our day in terms of the challenges.
Well, that brings one of the points I'd like you, or some of the points I'd like you to start addressing. What are some of the key ethical issues that you and the center are addressing, and help us to think through these things?
Sure. Well, one of the things that we do, and you and I have talked about this earlier, is we have a 24/7 consultation service available to anyone, free, and you will have a credentialed ethicist who will be available to you on phone or online, who will be able to respond to the questions of the day. And we tally those questions so we know what is certainly affecting people who are very concerned, facing difficult decisions at this time. We have about 1,400 of those calls a year. And increasingly, we see questions around end-of-life care issues, as well as questions related to reproductive technologies, contraception, fertility questions. But right now, especially as people are being faced with the Health and Human Services mandate to violate religious liberty, we're getting lots of calls about conscience protection also, and how to work in this world to impact the world as we are supposed to as laity.
When you talk about conscience protection, what areas of conscience need that protection? What are you addressing there?
Well, for us, because we deal in healthcare ethics, the people that we're hearing from are people going into the caring professions or who already are in the caring professions. For example, pharmacists are calling us in terms of we're being forced to dispense the morning after pill, which has the potential for being an abortifacient. We don't want to do this. And
so again, explain you know, how that pill basically works so that folks understand what's at stake.
Sure. Well, the morning after pill, if you read the flyer that is with it when it is dispensed by the manufacturer, one of the functions is to prevent ovulation, but another function, besides the fact that ovulation isn't always prevented, and it can only be prevented at a certain time in the cycle when a woman takes it, it can have an impact on the endometrium to prevent the fertilized human being, the embryo, from implanting and being nourished. It also says, and these are all in the flyer, that it could impact sperm motility, but the research tells us it doesn't happen quickly enough to prevent fertilization if the ovum is present, the egg is present, so that it can only work to prevent ovulation at a very limited period of time before ovulation occurs. It can't obviously afterward. It can't slow the sperm in a fast enough time frame to stop it from getting to the egg if it's already there. So the only other function possible is
to cause an abortion.
An abortifacient effect, yes. And pharmacists, in fact, they won in Illinois. God bless them for trying. They went to the courts and said, why do we have to do this? Because they were being forced to do it. There are a number of states that have mandates that a pharmacist must fill every legal prescription. They also challenged it in the state of Washington, and they've won so far, but that decision is being appealed. So that's one area. But a nurse in New York City was forced to do an abortion. She had given every appropriate notice that she would not do abortions. She was a surgical nurse, and she was forced to do it. We had nurses in New Jersey at a state university hospital who refused to do abortion, and they prevailed, but they were being told that they had to assist at abortions. We see it in our pregnancy crisis centers that are trying to assist in a good way to help moms carry their babies to term. And we saw in Baltimore, and they have won so far in court, but also in New York City, that the government is saying, but you're going to have to post signs that you don't do full reproductive services, meaning you don't do abortion. Now, do psychiatric hospitals have to post signs that they don't do abortion? It's so discriminatory, and we're seeing it over and over again in terms of trying to carry out our ministries, trying to carry out our health care.
Yeah, there is such a strong commitment by a certain groups in the country. Certainly Planned Parenthood is obviously very committed to abortion and promoting it. But we also see that the present federal administration is very committed to it. A number of folks in Congress are very committed to promoting this because, and what they say is, I think of former Speaker Nancy Pelosi speaking on the George Stephanopoulos interview, and Secretary Sebelius saying at a congressional hearing that they want to promote this because it will save money. That if we don't bring these children to birth, it'll save the government money. And this is the value that they are promoting. I don't say that it's their only value, but they're promoting that value.
Well, if we look at the Patient and Protection and Affordable Care Act, better known as Obamacare, despite what we're being told, it definitely will fund programs that provide abortion on demand. There's no doubt about it.
Which is against federal law.
It is against federal law, and they...
The Hyde Amendment prevents the federal government from financing abortions.
But there's no Hyde Amendment. As hard as the bishops of this country worked to try to get some protections in, there's no Hyde Amendment in Obamacare. And they've created this mechanism, which is a false mechanism, where they say, well, if you're buying your contract for health care in the exchanges in each state, and by the way, in each exchange there only has to be one health care program, health care plan that doesn't include abortion. So if you choose, let's say you're looking at the menu of plans available to you through Obamacare, and the one that's best for your family happens to have abortion in it, even if you're not going to use it, you have to write a separate check for that abortion coverage every month. And they're saying that way the government isn't paying for it.
Right.
But there are the community health centers, there's direct payment, although we have an executive order that says it won't happen. But one of the last paragraphs of President Obama's executive order says nothing in this will contravene existing law. And we know in Medicaid, if you didn't have a Hyde Amendment or some other provision in the appropriation that says we will not fund abortion, it went to the Supreme Court in 1977, it was called Beal versus Doe, that if you're providing essential services and haven't opted out of that abortion, you have to provide them. So we'll see what happens when it goes to court.
Right.
Whether it will be directly funded or not.
Yeah, see, this is, these are very, for most of us, complex
It is
legal
complex.
questions.
Very complex.
But it's, again, clearly, and this is my sense of what I understand, that because there is not really enough funding for the Obamacare, that's already, the Congressional Budget Office has said that it's underfunded already. Therefore, they're looking for ways to save money, and this is a big value for them.
We have to be
more so than our ethics.
We also have to be worried about the elderly, though. We know some of the money is coming from Medicare, and clearly there's a move towards assisted suicide in this country. We now have 3 states that have it before their legislatures right now: Vermont, Connecticut, New Jersey. It's already legalized in Washington and Oregon. And if you look in Montana,
and also Massachusetts just voted it down.
Thank heavens. Yes, they worked very hard. Both the community that advocates for persons with disabilities, and I told you I sit on the board of the National Catholic Partnership on Disability, and they have worked very hard, because the people who are going to be most vulnerable are those who cannot consent. And we see in the Netherlands there's a number of now cases in which, without explicit consent, people have basically been put to death through physician-assisted suicide.
Well, again, so folks understand, in the Netherlands, if your parents are so debilitated that they cannot consent to assisted suicide, then the children can give consent for them.
Supposedly that's not the way it's written, but if one can determine that that's what they would have wanted, and they have given some indication that that's what they would have wanted. And that's why it's so dangerous, because they've done statistics in Oregon. The health department does have to gather statistics from 1998 to 2011. 596 people have been put to death through physician-assisted suicide. You can't even put on the death certificate that that's how they died. You can't tell their loved ones.
You can't say that?
No, you can't. And you can't call it a suicide for legal purposes, and their family members might not even know it. And of all those 596, only 40 of them were referred for a psychological evaluation. Now think about depression and what leads to people to suicide. Maybe abandonment from loved ones. Mm-hmm. And actually they asked them, those who had taken advantage of, if you will, the medications to kill themselves, they were asked why they wanted them. And everyone says it's because of pain and finances. Those are the lowest two reasons. 82% of them feared the loss of dignity. Well, what does that mean? I don't want to be abandoned. No one will love me. Mm-hmm. No one will care for me. That's what that really means. So the movement into assisted suicide across our country is very, very frightening. We talk about children being euthanized in the Netherlands, which now is the Groningen protocol, where a parent can look over their newborn child and decide if this child needs to be euthanized because they're going to have very great suffering. Only anticipated suffering, though. It doesn't have to be something that's occurring right now.
So, and I heard on the news last week that this is being introduced into Belgium as well. So it's, again, sometimes it's portrayed as, elderly people saying, I don't want to, suffer and all this. But
those were middle-aged twins. There
were a couple as you mentioned, in Belgium, who were in their 40s, deaf,
and glaucoma, I understand, was the visual impairment, which is not necessarily a significant impairment. It can be treated. I don't know in their case, but again, those of us who advocate for persons with disabilities, who helped them to understand that they could have a better life, that life is worth living, that we can help you? Why did they think this could only be their only alternative? So the slippery slope is before us. People are saying, oh, you're just worried about what might be. It's happening.
Exactly.
And we're all at risk. We're all at risk.
And again, it's so striking to me that some of the advocates of euthanasia are saying this is mercy killing.
That's right.
They identify helping somebody kill themselves as an act of mercy. And this is, not what we mean as people of faith by mercy.
Caritas in Veritate said it. Right. Charity without truth is just sentimentality. And we have to ask ourselves, merciful for whom? The caregiver? The person who might be exhausted? Who might need some respite care? Who are we being merciful to when we eliminate the sufferer and don't help them and walk with them? As Spe Salve, we've been told by Benedict so truthfully that a society that does not walk with the sufferer is cruel and inhumane. And that's what's happening. We shun suffering in our society at all costs. Get it out of our sight, and now kill the sufferer.
Right. Well, see again, I know I brought up how already one of the governmental arguments in favor of abortion and birth control and sterilization is that it'll save money because the first year or so of life and the time of pregnancy tends to be the second most expensive part of life, getting all the various care as a newborn.
Immunizations and...
Right. But if they're saying that about the second most expensive part of life, what you're saying here is that they're also concerned about the most expensive part of life, which is at the end of life. That's when the medical costs are the highest.
Right.
And this may be another attempt at a money-saving device, a money-saving strategy.
There's great misinformation out there in terms of what the church's teaching is about end-of-life care.
Yes,
and
please.
it's actually highly valued. Palliative care is highly valued, good end-of-life care. And it does not mean that one has to be on a ventilator when it becomes a disproportionate burden, or remain on treatments that are painful and burdensome. People can die in comfort, and no one should die in pain. We have great palliative care.
For instance, somebody who has cancer, and it's gotten, oftentimes it gets very grave. And if they decide that taking chemotherapy is no longer worth that pain is worse than going through with this. The church does not teach that as immoral.
Never. And there's a great book by Archbishop Daniel Cronin as a young priest when he did his dissertation, his doctoral dissertation in Rome in theology, on ordinary versus extraordinary means. And you'll find the same presentations given by Pius XII when he talked about ordinary versus extraordinary means. The church has never said that one must engage in extraordinary means. We weigh the benefit to burden, and many of our calls relate to that. But what we're seeing is now people are weighing the burden of living, not the burden of the treatment. Oh, mom wouldn't want to live this way because she has some dementia, so let's deny her an antibiotic. And unfortunately, people have signed, when they were competent, advance directives, which can be very good, but advance directives that have signed away many of the things that they never meant to say they did not want. For example, nowadays, life-sustaining treatment can mean an antibiotic or just a simple IV for a person who's dehydrated, who's elderly, who often gets dehydrated. But they've signed a document thinking, oh, I don't want to live on machines, not realizing what they signed away. And now they're no longer able to articulate, and this document is out there. We advise, Father, that people have a good surrogate that they've had discussions with, that knows the will of the patient and the mind of the church. Because we say when you've seen one case, you've seen one case. You can't anticipate months to years out what the benefit to burden will be of any treatment until you're in the scenario. So a good surrogate is a much better way to go.
Now, something that I brought up on my other program a couple weeks ago about say someone is very ill. Is it, acceptable to withhold nutrition? Now again, there'll be certain cases, of course, they cannot eat.
Sure.
My mother had cancer, and she simply could not swallow. But we could give her nutrition and hydration intravenously.
Sure.
And that's what we chose to do. Is that optional, or is that something the church calls us to do?
The Congregation for the Doctrine of the Faith was asked this specific question by the bishops of this country and responded in 2007. And it was after the Terry Schiavo case, which she was not terminally ill. She was a person who was in we're not sure what the diagnosis is, claimed to be in a persistent vegetative state, who could have lived, persons with that diagnosis, lived for years, as she had, with assisted nutrition and hydration. So the bishops of this country asked the Congregation for the Doctrine of the Faith, what is the position on assisted nutrition and hydration? And it followed an allocution of John Paul, now Blessed John Paul II, where he talked about nutrition and hydration as being basic care, ordinary means. Unless it's going to be futile, unless death is imminent and it's not going to extend life because death is within a day or so, or the means employed, not the burden of living, but the means employed are going to cause suffering. For example, a person who has cancer that has spread through the intestinal tract and putting food in through a tube is going to cause bleeding, is going to cause more problems. Or, for example, if they have some sort of a kidney failure or a congestive heart failure where you're putting fluid in that the body is not going to process. And even sometimes the tube feedings can go into the lungs and they aspirate. So it's on a case-by-case basis, but we consider assisted nutrition and hydration as ordinary care, which should be provided if it's not going to cause more harm than good, physical harm. But people have looked at, well, the harm of living is what we want to prevent, so let's stop this. And people then die of not the underlying pathology, but of dehydration. But we walk those walks with folks who call us, and I know that you're showing our viewing audience how to reach us.
We'll get that information out. We're going to take a little bit of a break right now, and I'm sure that a number of you are going to have questions. We cannot give medical advice or anything like that, but we will be happy to give various aspects of the church's teaching on medical ethics. So please call in with your questions, and we'll be back in just a couple of minutes. Before we go to your questions, I just want to mention ways you can get in contact with the National Catholic Bioethics Center. One way is through the internet, which is you can just go to their website, which is ncbcenter.org. ncbcenter.org. Or you can also email them by writing to consults@ncbcenter.org. So consults, consults@ncbcenter.org. You can also call them at 215-877-2660, and you have 24-hour access.
That's right.
So people can call at any time.
Well, we do ask if they can wait until our 9 to 5 Eastern Standard Time, because at 2 o'clock in the morning when an ethicist has to work the next day, if it's not an emergency, we would ask them to wait till our office
Regular
hours.
office
yes,
hours.
But there are emergencies. People be calling us.
Somebody might be in the hospital at that time.
That's right.
And you need some help with a question.
That's right.
So this is not a 24-hour phone call
Chat.
that you do, because even my show hasn't put you to sleep. But this is, if you need something, an emergency, do it any time.
Exactly.
But regular questions during the main part of the day.
Exactly.
Okay. Also, we want to invite you to come here, like these nice people have in our studio audience, and be part of our audiences, as well as come to Mass and come here for tours of the studios. You can contact our pilgrimage department by calling them at 205-271-2966, Or you can also go to our website, www.ewtn.com, and get information there. And they'll help you with the scheduling of everything and information about places to stay locally, places to eat. We have some good places to eat here.
Alabama.
You know, we have some religiously themed restaurants.
I didn't know that.
Oh yeah, we've got Golden Rule Barbecue. And we've got a hamburger heaven. So it's very religious. So we'd love to have you come and join us. You ready for some questions?
I'm ready, Father.
Let's start off with Camille. Hello, Camille.
Hello, Father.
Hi, where are you from?
From New Braunfels, Texas.
Oh, I just drove through there a few weeks ago.
Oh, I wish you'd stopped and seen us.
Oh, thank you, Camille. I appreciate that. What is your question?
My question is, why is it so difficult to find the names of individual researchers who are trying to find a life-honoring cure for juvenile diabetes? And what do you think, do you think can be done to persuade Juvenile Diabetes Research Foundation to stop spending millions of dollars on embryonic stem cell research, which is, of course, not life-honoring and not giving us a cure God's way?
Now, do you have a child who has diabetes?
I have a son who is going to be 25 in February, who was diagnosed when he was 14. Mm-hmm. He did a bike ride to raise money to help kids who have type 1 diabetes go to Christian camps. He wants to know who to pray for, just like we do, by name of people, and we finally did learn Dr. Marcus Grumpy's name from Father Nick has been on your show, and Father Nick helped us get in touch with somebody at Stanford, Dr. Hilliard, and then we found out Dr. Grumpy's name. But he's the only researcher we know of that we can pray for by name at this point.
All right. Well, thank you very much, Camille. What about this difficulty of finding researchers who are doing their research in a way consistent with ethics?
Yeah. It is difficult, but science seems to be on our side, because the only real therapies, the breakthroughs that are occurring, are with the morally okay, the morally licit adult stem cells. So we're seeing some discouragement. In fact, some of the firms that were advancing embryonic stem cell research have closed because that's not where the breakthroughs have been. We do see a great gap in the juvenile diabetes research in terms of those who are advancing research that will not involve the destruction of the human embryo. But
yeah, just explain that a little bit. You know, why is embryonic stem cell research immoral, but adult stem cell research is ethical?
Sure.
What's the difference?
Well, one involves the killing of an innocent human life, and the other is using biological tissue that's morally received, morally obtained. But
because the adult can give permission.
Not only, you're not destroying the adult in taking the cells to create the embryonic stem cell. To get an embryonic stem cell, you must destroy the embryo. And there have been researchers who have said, well, we can take one or two cells from an embryo conceived through in vitro fertilization, and that embryo could still live. But what parent would consent to that? Because we just have a cluster of cells as an embryo when those cells are taken. So you're taking maybe 25% of the body of that embryo for research purposes. And actually, the success with that in terms of these embryos are being used for research anyway, so they're not being respected, the ones whose then they're
Whereas
trying
you don't have to take 25% of an adult's body to get the
or kill the adult,
or
kill the adult. And all the breakthroughs, the clinical breakthroughs, have been through adult stem cells, which are often taken from the person themselves. So there's no rejection. So, Camille, it is a problem, but I think as science is advancing through the good use of adult stem cells, we see that's where the successes have been. I know that many of you are aware of Father Tad Pahalczyk, who is our Director of Education. I direct public policy, he directs education. He's a neuroscientist, and many of us are duly credentialed either as scientists or clinicians. And you might want to give him a call because he's a real expert in this area, and he might know of someone else who's doing the work. I don't know because, as you have laid out, Camille, you've done the homework on this, that it's really very, very difficult to find.
Okay. Let's take another question from our studio audience. Ma'am, where are you from?
I'm from Mount Vernon, Ohio.
Good to have you here. Welcome.
Thank you, Father.
And what's your question?
Well, I was just wondering, the faithful in this country, it seems like every road we turn down, whatever we vote for, or they're working in the legislature, or it's just that the judiciary always has to make these decisions, and then the legislative branch of government just mandates it away, and there's just no, what do we do? How do we fight this? How can we move forward as a community of believers and just a community that respects life?
It's a very good question because these are difficult times, but there are also signs of encouragement. I keep statistics on what's going on in our legislatures, and actually the Planned Parenthood devotees, if you will, are bemoaning the fact that this past year it was the second highest number of bills being passed in state legislatures to curtail abortion. 43 state legislatures, 43 bills in state legislatures to protect human life. So we are seeing a growing awareness because of technology and because people are saying to the people who represent them at legislatures, this is what I want, because we're becoming more aware, especially our young people.
Well, and some of these laws that the legislatures are passing are laws saying that, you know, if your daughter is pregnant, you need to consult with her parents before you do an abortion.
Right.
You know, that
parental consent laws.
Yeah, parental consent, which is necessary for getting aspirin in the public school.
Tylenol, for sure.
And so if, you know, and so it's the legislature is saying, look, parents are not to be excluded from the decision-making process regarding their daughters.
Right.
And of course, their sons are the fathers of the child.
Right. And again, technology is on our side because I think young people, and at the March for Life just last week, it was incredibly impressive. Young adults who wanted to be heard. And our legislatures only represent us. I was a lobbyist for 10 years for the bishops in Connecticut. I directed their state Catholic conference. And they're going to hear the voices of the people who vote for them. That's very important. And actually, in some states, the judiciary is elected. In some others, they must go through a legislative approval process. And again, those same legislators are the ones who get voted in. So an informed populace is so critical to answer that question, to be heard. But it is changing. There are some good things happening.
Yeah, and I think also to let people be encouraged that we can move the discussion beyond mere emotion
with facts
and deal with facts from science and clear thinking.
Absolutely.
And that's what the kind of thing you all were trying to do. Let's take another caller. Hello, James?
Yes.
Hi, where are you from?
Yes, my question is for Dr. Hilliard, and that is, are there actually statistics of these nurses that are forced to do these abortions, that they seek counseling afterwards, and is the hospital or Catholic counseling center where they are going to counseling after being forced into this traumatic experience?
Thank you, James. So, is there some sort of counseling for these people forced to do this?
Well, luckily the numbers are small because right now with the Weldon Amendment that's not in Obamacare, although there is a provision that protects conscience in terms of abortion and the provider in terms of not having to provide it. The numbers so far are small, but the coercion can be very subtle. it might not be as explicit. For example, there was a university that it was Vanderbilt that at first said its interns, their nurse interns, would have to be willing to assist at abortion. That got overturned. So as people fight these mandates, luckily we're not seeing that many as explicit as the case I gave you with DiCarlo. Nurses have indicated they're having nightmares afterward, being very upset. And you know, the largest provider of social services in our country is the Catholic Church. We have clinics, we have Catholic charities, social services, and we're the largest provider of health care. So, and then, of course, anyone who's had an abortion, Project Rachel, is marvelous. It's a program to help, a sacramental program,
Yes.
to help women who have regretted and suffer greatly from, they're the
Yes.
second victim of
Yeah,
the abortion.
exactly. And I know a number of folks who work with Silent No More.
That's right.
For those who are speaking up about how awful their experience of having an abortion was, in Rachel's Vineyard.
That's right.
That does counseling and helps them come to deal with this in a personal way. So there's some good stuff available, and you know the Catholic Church will help some of these nurses or other people who are forced.
And the sacraments.
Yes.
Our sacraments are just wonderful. The reconciliation, beautiful thing.
Yeah. Have another question from our studio audience. Sir, where are you from?
I'm from Louisiana.
Good to have you here. And your questions?
It's concerning some of the statements made earlier about the cost of the young children and also of the older adults. I've heard of some research being done that in the last 40 years of the many abortions that have happened, that even if a small percentage of those abortions had not happened, and a small percentage of those people would be paying taxes and being productive citizens, that we actually wouldn't even have a financial problem in this country. I'd just like to hear some elaboration on that.
He's raised a very, very important fact that no one's talking about in terms of everyone being worried about the cost of aging in this country because of the baby boomers. You and I are baby boomers. But if we look at the birth rate over the last 50 years in this country, it has dropped 40%. And so we're an aging population. It isn't so much the number who are elderly in this country, but the percentage who are elderly in this country. And the cost of health care at the end of life, especially in the age group of 65 to 85, it doubles in that age there, because good decisions, good prudential judgment in terms of what needs to be done, not need to be done at that period of time, those good discussions aren't being had. But one of the big problems is the percentage of us who are headed towards that elderly population, if not, we're not already there, in relationship to the birth rate. And it is a statistical fact. And actually, the percentage of federal dollars spent on the elderly has remained consistent with the number, 13% of the population being elderly, 13% of the budget, federal budget being spent on the elderly. But the problem is that percentage of elderly is rising in relationship to the youth. And it's because the birth rate has dropped so drastically.
If you think of population as a pyramid, that the normal historical background is that the wide part of the pyramid is at the among the young people.
Should be.
And then it moves up to a top where the longer you live, the smaller that group is.
That's right.
So that, you know, George Burns' old comment that I want to live to be 100 because not many people over 100 die. However, you know,
I hadn't heard that.
Yeah, but there aren't many people over 100. That was normal. Today, the pyramid is being inverted. In some countries like Japan, and it's coming to the state of Israel, and in many parts of Europe, that the young people are at a smaller ratio, and the pyramid goes out to the elderly.
True.
Very big issue in Japan. And you know, the elderly can't have more babies to fill in that gap. So this is going to be a growing problem.
And no one to take care of the elderly.
Yeah, exactly.
No one to take care of them.
We have another question from our studio audience. Ma'am, where are you from?
I'm from Columbia Station, Ohio.
Great. And your question?
With the problems of a living will, have you heard about American Life League's document called The Loving Will, and what do you think of that?
I can't say that I have seen that document, but I think any document in which people allow for a surrogate to have, an informed surrogate, to have the will of the patient and the mind of the church in mind for decision making is a good document. And that's what we advocate for, that the living will can have some general guidelines, but most importantly, have those discussions with a loved one. Have those discussions so that they can navigate the issues as they occur. I don't know of that document. I know that we're very concerned about documents that are checkoffs. I do not
What
want...
do you mean Chekhov's? This is a Russian name?
No,
not that
no,
Chekhov.
Father, no. Little boxes that I do or do not want assisted nutrition, hydration. I do or do not want antibiotics. I do or do not want to be resuscitated. All of those things are so case specific that they need to be looked at within the situation. And so again, some general principles, some general guidelines, yes, but a good discussion with a surrogate. And that's what we advise. We have a document that's available, and people can go on our webpage and bring it to their own state health department to see if it would be sufficient legally for their state, but it's a good document consistent with the mind of the church.
Mm-hmm. You see, so it would be also good, I mean, you may not have to go to the state, but you can consult a lawyer
Certainly.
in your state who would have some idea of local law.
Sure.
Because states do vary. And so, but this document is available.
That's right.
At your website. And again, I'll give that website. It's ncbcenter.org. ncbcenter.org. And you can also write them an email by writing to consults@ncbcenter.org. Or again, you can also call 215-877-2660 and find out more about, a model, like this lady brought out, a model for not just a living will, but a loving will, so that, and again, a piece of paper cannot love you.
No.
It's going to be
the person
a
who
piece of
implements
paper that has guidelines. But you're emphasizing this role of a surrogate, someone that you give a legal empowerment to. Is that true?
That's right.
Yeah. So that you give a legal empowerment to somebody else who understands what you want. And, some rough guidelines may be written down, but again, there are some very important issues that have to be decided, like no resuscitation. Well, in what cases?
Right.
Now, are there some cases where resuscitation is a good thing? Like, do you know of such cases?
Oh, certainly. And we don't discriminate against persons based on age or disability, but there are some times where resuscitation is clearly not going to extend life.
Yeah.
It's just going to prolong, as we say, the dying process. You might bring them back for an hour, a week, and
or a few minutes.
Or a few minutes, right.
My grandfather, we always told him, George, they always spoke in Polish, but we told him, George, you're going to die of a stroke, because he would take fat. You cut fat off a piece of meat, he would spear that and eat it.
He loved it.
And he just eat it, and sure enough, he died of a stroke at age 95.
Oh, well.
But
he had the last laugh.
Yes. But one of the things that the doctor came out when he was in his last few minutes and said, well, we brought him back 17 times already.
Yeah.
I said, why?
Yes. Yeah.
Why?
Right. We're meant for heaven. We are meant for heaven. We don't have to do
Get all
extraordinary
the
meals.
fat you want up there.
I thought it was candy bars when I was a little girl.
Well, maybe it depends on what you're wanting there. But it's these things you have to think through.
That's right.
what's
Prudential
possible.
judgment.
Yeah.
Prudential judgment. Yeah, the rational person participates in the divine law. That's what natural moral law is. Faith and reason.
Working
and we're
together.
called, yes, and we
And that's exactly what the church is trying to help us do. We want to thank you for being with us. We've
it's been a
run
pleasure.
out of time.
Yeah, it's been a pleasure.
And let me give you all a blessing. May Almighty God bless you and keep you and cause His face to shine upon you and lead you in all of your ways by His peace. The Father, the Son, and the Holy Spirit.
Amen.
We can bring Dr. Hilliard and so many other guests on here, as well as do many other programs, because this network is brought to you by you. You make this possible. So please keep us in between your gas bill, your electric bill, and your cable bill, and we'll be able to pay all of our bills too. Thank you.